So today we are going to discuss about the clinical case discussion of swelling. So swelling will also come as a short case in your exams, in your surgery postings, in your surgery exams. So today we will discuss how to take the history and how to do the examination of the swelling. So first of all, I will show you different types of swelling that you are going to observe in your OPs. First, in the first picture you can see sebaceous cyst. Sebaceous cyst is actually a blocked hair follicle, and this can blocked hair follicle duct, and this can give rise to a cyst. You can see in the picture, this is actually the hair follicle duct will get blocked, and so it will give rise to a cyst. Okay. And in the next picture you can see a dermoid cyst. Dermoid cyst, I have already made a separate presentation on dermoid cyst. It occurs when the epithelial elements get entrapped, means the epithelium will get entrapped along the lines of fusion, means it is the fusion of the epithelial elements, that is dermoid cyst, and you can easily observe it on the outer canthus of the eye, in the post-auricular area. You can very commonly see the dermoid cyst. It is the accumulation of epithelial element. Then next, this is ranula. Ranula, you can see it below the tongue. This is again a cystic swelling, and you can easily observe it under the, it is a mucus swelling actually, and you can easily observe it under the tongue involving the sublingual salivary gland. Then next is lipoma. Lipoma is again a soft tissue swelling. It is the accumulation of fat. Okay. In the next picture you can see cervical lymphadenopathy. So this cervical lymphadenopathy is mostly associated with tuberculosis. It is again a swelling, means it involves the cervical lymph nodes. Then in the next picture you can see the again a swelling, that is cystic hygroma. It is sequestered lymphatic tissue. During embryogenesis, it is a sequestered lymphatic tissue, and you can easily observe it in the neck, in the axilla, in the inguinal region. Here you can see this swelling in the neck. This is cystic hygroma. So these are all different types of swelling that you are going to see in an OP. The cervical lymphadenopathy is common with tuberculosis patient. It is common in them. Cystic hygroma, then this ranula, lipoma, and sebaceous cyst and dermoid cyst. So now any swelling might come. The format will remain the same. So now I'll show you how to take the history. Okay, first of all, let us suppose a 58-year-old female presents with scalp swelling. Okay, that female is having a swelling in the scalp region since 4 years. Okay, and it was gradually increasing in size. Okay, means initially the patient noticed that the swelling was small in size, but now it is increasing and it is painless. Okay, no pain, but the patient gave history of occasional thick whitish discharge from the swelling. So you have to ask what is the onset of the swelling, and whether it is progressing, whether its size is increasing or not, whether it is associated with pain or not, and then you have to ask about any discharge coming from that swelling. So occasionally thick whitish discharge will come from the swelling. Then negative history. So no past history of pain. Okay, no pain associated with that swelling, no redness, no inflammation is there. If redness or if inflammation is there, means no infection of that swelling is there. So no redness and no inflammation of the swelling, only simple swelling which is not associated with pain, and no history of headache, because if headache is there with that swelling, that means there is intracranial extension of that swelling. It has involved the brain region as well, but no history of headache. Okay, then no other swelling over the body, because sometimes neurofibromatosis and lipomas, how they appear is multiple swelling will be seen on the body. Okay, so that only single swelling, so that means it is not neither neurofibromatosis, it is not lipoma. So we are, with each and every point, we are ruling out certain swellings, and we are getting specific in our direction. Okay, in this direction we have to focus. This might be that swelling, this might be the cause of the swelling. Okay, so no swelling in the neck. Okay, if there is no swelling in the neck, okay, that means lymph nodes are not involved, so this is not cervical lymphadenopathy. Okay, in this way you will go step by step. Okay, you have to ask about the pain, any redness, any inflammation, any headache, any swelling. Apart from that area, any other swelling in the body, any swellings in the neck, any lymph node swellings. Okay, next is past history. Okay, no comorbid conditions. Patient finished her chemotherapy for ovarian cancer. Okay, patient has finished her chemotherapy for ovarian cancer 3 months back, and she was diagnosed 4 months back. Okay, means she was diagnosed 4 months back for ovarian cancer, and she has underwent a surgery 3 months back. Okay, so we got another point that this might be associated with that ovarian cancer. So we are going to rule out all this step by step direction. Okay, Next is family history. No family history of cancer. If any family history of cancer is there, then this might be associated with some kind of malignancy, because the patient will have increased chances of cancer, no? Then personal history, okay, the person is a non-vegetarian diet. You ask about bowel and bladder, sleep, and any addictions you have to ask. Then impression after history. Okay, after history, what impression you are getting? Okay, a 58-year-old female, okay, comes to OP with painless swelling on the scalp since 4 years and recent history of ovarian cancer. So we get this idea. Now, okay, now you know that this swelling is on the scalp region. Okay, and it might be associated with ovarian cancer. So now we will go for the examination of that swelling to confirm which kind of swelling it is. Okay, general examination. The patient looks well nourished, well hydrated. She's middle-aged female, average build, and all the vitals are stable. You have to measure the vitals, okay? I have written here vitals are stable, but you have to measure vitals in that patient, or blood pressure, respiratory rate, pulse rate, and temperature, if febrile or whatever, you have to mention, you have to measure, okay? Then general physical examination, normal. Post chemotherapy, she is having alopecia, okay? Means hair loss is there. Then local examination. Okay, now we are going to examine that swelling. On inspection means you are not going to touch. Inspection means just you are observing it. A 3 into 2 centimeter swelling in the occipital region means it is located behind, on the back of the head, in the occipital region. No ulceration with that swelling. Okay, no dilated veins, no punctum, no signs of inflammation, and no cough impulse. Cough impulse will be seen in intracranial extension. That means you ask the patient to cough. If that swelling increases in size, that means there is an intracranial extension with that swelling, but there is no cough impulse. Okay, no transillumination means you have to pass the light, and if that you can see the area beneath that is transillumination. So there is no transillumination, and you can see transillumination in meningoceles because it is in the scalp region. No, it might be meningocele, but no, there is no transillumination. So we have ruled out meningocele. Okay, now you are going to palpate. That means you have to touch the swelling and then you have to observe. In palpation, okay, swelling is non-tender, no pain. It is firm. It has well-defined margins and fluctuation is present. That means if you move it, it is moving in the two axes. It is fluctuating, and skin cannot be pinched. You try to pinch it. If the skin is pinched, that means swelling is not arising from the skin. But if the skin cannot be pinched, that means swelling is arising from the skin itself. Okay, skin cannot be pinched here. That means the swelling is arising from the skin itself. If you try to pinch it, it cannot be pinched because it is arising from the skin only. Okay, non-compressible. And if you try to compress it, it is non-compressible, and it is compressible in meningocele. So that means it is not meningocele, and there is no palpable lymphadenopathy. Okay. So now, observing all this, what do you think this can be? It can be a sebaceous cyst, because that it can be present on the scalp also, and all these features are giving us an idea about sebaceous cyst also. It can be a carcinoma, basal cell carcinoma, or it might be related to ovarian cancer. So now we will see what are the points in favor and what are the points against all this. Okay, sebaceous cyst, since it is having whitish discharge, okay, it tells us it can be a sebaceous cyst because the sebaceous cyst will also have a whitish discharge. Okay, scalp common site, yes, sebaceous cyst is very commonly seen in the scalp, and skin can't be pinched. Okay, this is also giving us an idea of the sebaceous cyst only. Fluctuation present, yes, and classical punctum seen. Okay, this punctum you are observing here is against. That means punctum will not be seen in the sebaceous cyst, but all remaining points are favoring sebaceous cyst. Means punctum can be there or it cannot be there, but remaining all other points are favoring sebaceous cyst. Okay, now we will check for basal cell carcinoma. Scalp common site, yes, it can be. Skin can't be pinched and no ulceration, because if it would be a carcinoma, then there would be ulceration and the skin should be we should be able to pinch the skin, but these 2 points, main points, are against it. So it is not a basal cell carcinoma, and there is no ulceration. It is a very important point which rules out basal cell carcinoma. Now, whether it is related to ovarian cancer or not, no, because the swelling was there before diagnosis of ovarian cancer. Even before ovarian cancer was diagnosed, swelling was before that. It is not at all associated with ovarian cancer. So these all points favor that this is a sebaceous cyst. Then you can go for investigations to confirm. That is, you can go for FNAC, fine needle aspiration cytology. You can go for X-ray of the skull. You can do the X-ray of the skull, and FNAC is revealing sebaceous cyst. Okay, and what is the management? You have to simply excise it. So this is all about clinical case discussion of swelling. Thank you.